On the DocTalk show today, we discuss a rather sensitive medical challenge in the Ugandan society: male and female infertility.
Ideally, a happy home is one with children running around and making noise in the house. Unless a couple has decided not to have children, most couples after marriage look forward to a home with children. However, we have a few couples that are still finding it a mystery to have children in their marriages. Today on the DocTalk show, I'm here with Dr. Jaffa and Dr. Billy to discuss why this is what we call infertility in the medical world. Why we have infertility, what can be done about it, and where are we headed?
The African tradition has always been a problem. The pressures come from wherever, from the lady's side and the man other side. Because even if you hear those speeches on the wedding days, where people always promise that we pray that you have children,
Twins.
Even twins. So the pressures, so it always gets very distressing if a couple gets into the phase of looking for children.
That is a big medical problem called infertility. It is looked at as a failure of a couple, to bear children after living together for 1 year and having regular sexual intercourse.
At least 2 to 3 times a week, regularly, and living together
for at least
for
one year. So if of course, many couples, when they get married, they expect to get pregnant, to conceive in the first month of marriage. Or
the mother-in-law is the one who expects you to conceive in the first 2 weeks.
Most of the people you will have in your clinic won't last a year. But ideally, we encourage people to take some time together, have regular sexual intercourse, non-protected sexual intercourse, without use of any family planning method.
It's very, very stressing, because whenever they meet the bride, they always say, hey, is the Mugole vomiting? What is happening?
Exactly.
So the pressures pile up. That's why we see them in our clinics.
For raw mangoes?
Yeah, raw mangoes. That's why we see them in our clinics as early as 3 months post-wedding.
What distresses me the most is the fact that everyone expects that the problem is with the woman. No one expects that their son has a problem. Yet we know that when it comes to infertility, anybody could be the cause.
It's a very big problem that has even caused separation of families. Yeah, people end up divorcing or separating. They actually don't usually divorce formally. They just separate.
They separate.
Either someone will walk away, or they will try to find children somewhere else. Yeah. Once they do that, then eventually this marriage.
And by the way, the male infertility is also on the rise.
On the rise.
Male infertility is a rise. Like it is the sedentary lives we are living. Lots of alcohol we are drinking, and growing fat.
Of course, majority of the cases are on the female side.
Yeah, but also
most of the problems.
But the male shouldn't be out of this.
Yes, but of course, also a good section of males have a problem.
Yes, and it has forced the ladies to do the other things, maybe to get children from outside the wedlock, so that they can protect the marriage. Yes. I'll tell you a story. There's a gentleman who came with a wife, and they had 3 children. And apparently these children, they resembled the man when you look at them. They say,
always have.
Yeah, they say, doctor, you see, doctor, we have had, and the man has increased. We need to have at least 1 more. I said, okay, let us do the routine test. I sent the man and the man to do the test. It came out that the man was the problem. The man didn't have a single sperm. So I first,
he was firing blanks.
So when I first contacted the wife said, oh, doctor, please don't spoil this. I know this man can't do anything. He can't even produce, but we do these things to protect their marriage. So
but she should have also still done what happened the first time.
Yes, because I had to assure the husband, don't worry, maybe the child will come. Because the wife they have lived together for 10 years. I couldn't spoil it. I couldn't spoil it at that time.
I know you're a good Christian.
but we need to remember that infertility used to happen even in our grandfathers' days, only that the communities had found a way of dealing with it. If a man couldn't have children, without letting everyone know, the brother would come in and try to help with the problem. If a woman couldn't have children, they would bring their younger sister or someone, and it was dealt with. But in the current...
of course, the current situation, it always takes quite some time for people to realize that it's a man with a problem. Unless a man has already maybe problems with picking up an erection, But if a man is able to pick up an erection, it's always assumed that it's the woman with the problem.
It's a woman's problem.
Yeah, and most of the time, the people that you see seeking medical attention are the women. It's always you, the doctor, will advise the woman.
Also bring the man on board.
And bring the man, and which is also another big problem.
Yeah, but I think this problem is a burden to the families, to the unity of the family. But as you see, Uganda, we have a very highest, one of the highest fertility rates. So I think that's the reason why the countries would give us support, or even the government is not putting so much attention to it.
To women, to help those who cannot have children.
Because a few centers which deal with these conditions, you find them very expensive.
They're very
because
expensive.
The government can't subsidize on anything because they know it's not a problem. Our problem is not to have children.
Our problem is having too many children.
We have too many.
But yet we need to take care of these women.
We know the few mothers we have found, or the few patients we have found in our clients in our clinics, there is a big problem. And you see them very stressed.
Yeah, but then, you know, a woman has grown up very well in a Christian family, brought up, very saved, she's the church choir leader, and then she gets married and can't have a child. What's happening? What could have made her get
There are no risk factors, no infections.
Her mother had 8 children.
And she has been a virgin all through until the wedding day. So you wonder where the infections coming from.
The majority of these patients that we see, the commonest cause of, especially in women, female infertility, is a problem with their tubes. It is a tubal factor problem, what we call a tubal factor problem. When your tubes have a problem, they cannot transmit the egg, the male sperm. That is the biggest. Majority of them will have a problem.
The tubal factor is a problem because they need to remember that the sperm will meet the ovum or the egg in the tubes. Fertilization will take place in the tube. So if the tube has a problem, maybe it's narrow or it's blocked, meaning the egg will never meet the sperm. There will be no fertilization, there will be no children.
Okay, and majority of problems of the tubes are caused by previous infections, pelvic infections. You can have infections originating from your vaginal area, then they move up to affect the tubes, and then eventually they get blocked. Or you can have rarely an infection from your blood.
Yeah, many gonorrhea and chlamydia.
Yes.
But we also have people who could have had surgery near the tubes.
The tubes, yeah.
And then when you heal and have a scar, the scar closes off.
Yes, especially
causes the tubes to bend.
Removal of fibroids, very common operation these days. Yeah, so ultimately the scars can affect the tubes, either kink them or twist them so that at the end of the day they are blocked, they cannot do their function.
You are watching the DocTalk Show.